guys, good morning. Today we are talking about an interesting case. So, what are the consequences of an hair transplant? If you undergo transplant age less than 25 years, that's what we are going to discuss and show example of such case and discussing more details about what are the consequences that you would face when you undergo transplant age less than 25 years. Most of the clients, when they inquire, they straight away ask for the cost of the transplantation. Basically, they don't inquire about whether transplantation is possible for me or not, or am I a good candidate for transplantation or not. They don't ask. They directly ask for what is the cost of the transplantation. So when we ask for the scalp photos and age, most of the time, so age less than 25 years guys will look for transplantation details. We would recommend them. Transplantation is not recommendable because of age is less. Now we want to discuss more details about why one should not consider a transplant less than 25 years is an important point here. Number one point is, imagine we usually lose more hair age 21 to 25 years. Of course later also hair fall can happen, but this era, this age 21 to 25, you lose more hair because of few reasons. Because of young age, early hair fall started, a lot of stress levels are there, and because of hormonal changes in the body will happen. These are the few reasons. So for this, not only as a doctor, even common man can understand this. When you are so young, you will be losing more hair. That means hair transplantation is recommendable only when you have a less hair fall or hair fall stabilized. Usually, so age 21 to 25, you lose more hair. This is the reason we don't recommend hair transplant. If you do hair transplant in that time, of course, after the hair transplantation, still you will lose more hair, and there's a gap again forms in the mid scalp, or you would need second session, or you may end up in a failure transplant. And kindly remember, hair transplantation goes with the availability of the grafts on the backside. So you cannot simply waste the grafts also. So these are the reasons one should not consider less than age 25 years. Few important points one has to understand when you are undergoing a lot of hair loss age less than 25 years. Number one is, kindly remember, hair transplantation does not stop further hair fall. That means people think that, okay, I have taken medicines, we still I am losing more hair, doctor, but I want transplant. It doesn't help you, because hair transplantation only useful when you have at least less hair fall and stabilized hair fall. This is number one. If you take hair transplantation in age less than 25 years, I'm sure nothing is going to happen to you for health wise. What can go wrong is, imagine you are end up with only class 2 baldness where transplantation is not necessary. But if you go for a transplantation, few clinics would do transplant for you. There you will lose your donor area, or you are unnecessarily spending this hair grafts unnecessary area where it is not important for you, because you may need in the future somewhere in the mid scalp. So these are the two mistakes can happen if you go with a transplantation age less than 25. Another point is, there are a few exceptional cases. Someone is completely bald by age of 23, 25 years, you can do it. But I'm talking about on a general note for general patients. Well, such example of one case I would like to show you today. This man was the age of now itself 23, and he was maybe 21, 22 when he underwent a previous transplant. And this is a typical example of what happens, what can go wrong with a transplantation planned age less than 25. In this patient particularly, there are two mistakes happen. Number one is, a wrong age he went for the transplantation, number one. Number two, and someone made wrong design also. Imagine the bad combination. Imagine he has some other problem, problem has been fixed. In the sense, number one is the age itself is very less, where he has undergoing a lot of hair loss, and that is one mistake. Second thing is, and someone has designed a wrong plan. Both are wrong. Then obviously he'll end up in a kind of a very bad situation. Now, when he just came to my consultation, by then he had one transplant, which was a failure transplant, and where earlier clinic just designed hairline very front. Now here, not only correction of the hair transplant we have to do, even we need to remove the unnecessarily placed graft. Kindly remember these two factors. He has been losing the more hair loss, and he wanted one more session for that losing hair. Whereas because of the wrong plan someone has done, removal, again we need to do one more session. Kindly remember, this removal will not happen in a single session. So multiple sessions you need it, 2 times, sometimes even more. Imagine one session for correction of the transplant which has happened due to the hair loss, ongoing hair loss, and second thing is removal, 1 or 2 sessions. So you need to spend a lot of money for correction. This is because first underwent less age, and second thing is a wrong plan. Both combinedly happened in this patient. We would like to show this, present this case after repair, and we've been almost we removed this frontal area one time, and we wanted to show complete story of this patient. Now, during the first consultation, and we have planned hairline correction and a few grafts removal. So our priority was in this patient, we need to implant some grafts in the mid-scalp where thinning out because of the ongoing hair loss. And second priority was removal of the grafts. So in this patient, I didn't want to use more grafts because probably in the future, because he's only 23 now, I'm sure he'll lose more hair. Again, we need to do few more grafts. That's the reason we meticulously planned with less grafts, filling in the mid scalp to get a better outcome. As well as we removed one session of frontal area. You can still see 80% of the hairs has been removed, few more left there. Probably we need another session to do that. And this patient, we achieved a fantastic outcome with one session with few grafts. Now we removed almost this frontal area, 80% of the unnatural grafts. I'm sure you would need one more session for removal itself, or in the future, if you lose more hair, I'm sure one more session you wanted to undergo in the mid scalp. That's what we achieved in this patient with meticulously planned surgery. So this is an example of a patient who underwent wrong age and even wrong design of the hair transplantation. Well, there are a few exceptional cases. Imagine you are bald by age of 23, completely bald. There is nothing to lose, and you're left with only backside hair. Then fine. Such cases definitely we can plan transplantation. This patient, an example, someone who's having hair and undergoing hair loss, just sake of getting class 2 baldness corrected, transplantation is not a good choice. Remember, class 1, class 2 baldness is a kind of a natural receding hairline. One should not much worry about it. So there are a few exceptional cases. Other than that, someone is undergoing hair loss, just like in the frontal area, better to wait and watch, take medication or PRP to reduce the hair fall first, and then maybe you can think about transplantation in the future, because your donor is most important and very precious. You cannot buy that. The donor, once you removed and spoiled it, you cannot definitely buy or do anything with that. So it's here, raw material donor is the most important key for the getting a good surgery done and getting a good results. So this, I hope this video would help a lot of youngsters to think about whether transplantation is necessary or not. Rather, you are asking the question like how much it cost. Go with the doctor's opinion whether am I a suitable candidate for transplantation. Is it worth doing transplantation in my case or not? After that consultation only, you can decide whether you need to go with the transplant or not. Thank you.